welcome you to visit with our faculty tonight, and hopefully this will give you an idea of the vast expertise shared in this very room. This is our second annual College of Health and Human Services celebrating our engagement. It's a way to be able to not only showcase the great work of our faculty done in collaboration with our students, with our community partners, but it's also a way of being able to introduce to the broader community new faculty who've joined us over the past year. As the College of Health and Human Services, we certainly train folks to enter the health and human services arenas. Often our folks move into those areas as a result of that desire to serve and to give back. We're not really good as a college to toot our own horn, and this is a way of really being able to tell the community all the great things that our faculty are doing to better serve the region as a whole.
And so the study examines different cases, different forms of pollution, different parts of life, and different kinds of health outcomes, trying to get a comprehensive picture of how air pollution affects young people.
My project is about water reuse and water quality. So as we all know, Southwest in the U.S., in the United States, we're facing severe drought, and the only freshwater source we have is only 3% in this earth, so we are trying to recycle the treated wastewater for drinking water source.
This project incorporated bringing community dwelling older adults onto Fresno State's campus. These participants had low bone mass, either osteopenia or osteoporosis, and we incorporated a 10-week home exercise program to see if we could improve both their balance and their strength through these 6 sets of exercises. And the outcome after 10 weeks was that their strength improved as well as their balance.
The project I'm working on is looking at how overweight and obese individuals exercise. I'm a physical therapist, so a lot of my research is looking at how obese females do physical therapy exercises. And what it did in this project was just looking at how much stress they are putting on their knee and hip joint while they are doing 2 common exercises, which is a squat and a lunge. What we found was if you are an overweight female between age of 30 to 45, you're putting a lot of stress on your knees, especially doing a lunge, and that might have implications in our PD clinics. This project is especially important because about 2/3 of US population is overweight and obese and has huge implications in the Central Valley, and that's why we're doing this project. That's why I'm part of this health cohort here, making sure we are addressing the problems unique to the valley as well as the country overall.
This was a research project that a master's student did for her thesis based on a technique that we were experimenting with for reducing echolalic response in children with autism. Children with autism tend to give echolalic responses, which means that they tend to repeat whatever it is that is said to them. So we decided that we would start by modeling what it is that they need to say. So we would hold up a piece of a cookie and we would say, "I want a cookie." And then they would say, "I want a cookie," and we would give it to them. And we would do that like 3 or 4 more times to establish that response, "I want a cookie." And then we would hold up a piece of cookie and say, "What do you want?" And because of that behavior momentum that was established, they would come up with the non-echolalic response, which would be, "I want a cookie." And of course we would give it to them. And we reduced the number of models gradually until they were coming up with the non-echolalic response with just one question. "What do you want?" "I want a cookie."
The project that I did was part of a faculty learning community on interprofessional education. The purpose of the study was to investigate the perceptions and attitudes of staff, faculty within the College of Health and Human Services. The reason I think it's important to come and present is we all have really busy lives, and I think sometimes we don't pause and reflect on the good work that we're doing and also the good work that's being done by the college. So I think it's a great event to network and to see what's going on.